Well, good afternoon, everyone. Welcome back to our Department of Labor and Economic Opportunity webinar series focusing on workplace mental health. So as you all know, there's a Q&A box on your screen that you can submit questions to at any time throughout today's presentation. We'll get to as many as we can at the end. And as I always say, if you haven't already, please make sure you sign up for emails on our michigan.gov/workplace mental health page. Site also includes all the recordings. It'll have this recording when it's ready. Our report, the Surgeon General's report, other links to resources and information. And as you all know, we focus on those three pillars being things that are happening in the workplace, things that are affecting the workplace, that are coming into the workplace, and then individual behavioral health supports. And we try to make sure we hit on all those pillars throughout the various webinars and content that we provide. September is Suicide Prevention Month, and we've done a number of additional webinars and events throughout the month, including our week-long focus on suicide prevention in the construction industry. And that's in collaboration with OSHA and our state plan, MyOSHA. We were at sites across the state. We did an event over at the Gun Lake Casino Hotel project with a few hundred construction workers and had a great discussion about the things that are impacting that particular industry and things that resources we might be able to use to deal with that. And throughout the month, because we're talking about suicide prevention, it seems like, or you'll hear a lot of focus on men. But I always want to make sure everybody understands that it's not just men that die by suicide. Women, in the studies that we've reviewed, women actually attempt suicide more frequently. So we don't want to lose sight of that. So if it sounds like we're only talking about men, part of that's because of the difficulty in getting men to go get help. So women, you're in the same boat. So we got to make sure that we're all thinking about this the same way and that we're all moving toward decreasing the stigma and getting the help that we need. So for our final webinar here in September, we're going to talk again about the construction industry in particular. And that's largely because this industry is seeing much higher rates of death by suicide than other industries, significantly higher in most cases. And when we close out today, we're going to play a short video from our friends at Man Therapy. We did that as our first webinar in September, the first week of September. That's available on our website. It's a tool that was developed to try to reach men in particular and give them the tools and techniques and encourage them to seek support therapy when they need it. So hope you enjoy that. And we have a great expert joining us today, Dr. Sherri Kermanshachi, who is a PhD. I think I was close. She'll let me know if I wasn't. We'll be discussing suicide and mental health challenges in the construction industry in particular, and brings a wealth of knowledge and connections in this industry to help us better understand kind of what's going on there and some of the challenges. So I'll turn it over to you, Dr. Sherri.
Hi, Sean. Thanks a lot. And yes, you were close. So I'm Sherri Kermanshachi, as you mentioned, Vice Chancellor for Research and Outreach and Professor of Civil Engineering at Penn State. And thank you for organizing such amazing webinars. This is a very important topic. So, and much needed to be focused. And I'm very glad to go into some numerics, statistics, and details on this topic. So looking at mental health challenges and the path to suicide, just going over some numbers, 1 in every 5 Americans, they experience mental health challenges at some point in their life. And this is something that it was reported might be even more than that. And the people are suffering in isolation. And we have seen that number of the suicides or number of suicides that we lose people are much more in men than women. That's interesting because we see more suicide happening in women, but we have more losses by men. And the reason is most men use more violent techniques when they want to do suicide compared to women. So the time to save them is much less compared to women. And when we lose people due to suicide, 90% of time they have other mental health challenges or some mental health challenges which could have been understood before if there was intervention. Some examples are depression, anxiety, substance usage, or PTSD. And so it shows that suicide by itself is a very, very unfortunate event, but it's a long journey that a person goes through it until they take their life at the end. And construction, as you mentioned, is one of the industries that we see so many losses due to suicide. It has several reasons, and we will go over them. But occupational suicide is something that I always say it's a lose-lose-lose situation for everybody. Losing somebody who is productive for the society and the impact that it has on the family members. And I would say that impact, not just family members and the community or society, but it's generational. And it's very unfortunate, in addition to the impact that it has on the society, losing a productive member, and for the employer as well, because it's not as easy as some people think to replace skilled people. So with all these statistics that mentioned and all the impacts that we talk about it, there are several factors that cause this unfortunate event to happen, and let's look at them in detail. Why construction has more suicide cases than other industries, and it's comparable to mining industry. Most people understand mining industry has a very difficult nature, but with construction, maybe some people do not know the details on what's happening. So here you see some of the main categories of the factors that have impact. So one of them is environmental factors. Construction by itself is known for the harsh working conditions. Many times its safety is concerned for people, especially in, for example, transportation infrastructure. If there is a maintenance project that workforce need to work long hours during nighttime and the visibility is low. So it's a harsh working environment that it takes long hours. Many times the irregular schedules that we see in projects or long shifts that we have at night. And it's a very isolated job in some construction sites. People have to do a task separately, and there's not much time to network or share personal stories with each other. And we will get into the later to other factors that why people do not share their story compared to other industries. There are some other personal factors involved, such as social isolation and financial insecurity is another major problem. Many people working in construction site, they are working paycheck to paycheck. They cannot afford to lose 1 day of work because they might not be paid for that specific day. So getting a day off just because they have a mental health breakdown may not be an option. And in those cases, although they are suffering from anxiety or other type of mental health, they still have to continue going to work. Not only it affects them, but it brings down the safety of the construction. It might cause accidents, and also it will build up in future, which goes down the road to becoming a suicide, unfortunately. And fear of failure, that's mostly, as you mentioned, Sean, it's around men, but we don't want to just talk about men. Women are also suffering, and there are different factors affecting women. Isolation for women in many cases is more in construction sites because we have few women who work, or comparatively there are less women who are working on construction sites. And there are other factors. Languages sometimes they are used in construction makes them to not be included in discussions, or they prefer not to be included. And also the PPEs, they are not in right sizes for women because most manufacturers, they tend to produce them and supply them in sizes that are mostly used for men because it's a male-dominated industry and we all know about it. So family conflicts, because the time of the projects, sometimes you have these scheduled driver projects that workforce, they need to work longer hours. That also causes a problem. And one thing I want to mention, it's not just for people who work on site, but it also for people who work in the office. So construction by itself causes problems. People who work on the field, they see major problems, but it's comparatively, it's high for those who are working in the office too. Organizational factors, many organizations, especially smaller ones, they do not have the capacity or maybe the awareness that they need to provide to support for their staff. They do not have the infrastructure to provide training and decision making. Many times people feel that it's not fair. That might be perception or it might be the reality, but that causes also some problems. And many times there is not adequate and sufficient possibility of expressing opinion with the supervisor, so people feel that they are not heard or they are not taking a part in decision making. Some other work factors we talked about it, the load might be high for some people, especially with the schedule driven projects. The roles may not be clear. Sometimes there's a conflict with supervisor or how they see the project or the expectations that exist in the projects, and there are other factors. Cultural issues. One of the interesting things we talked about is cultural factors. So stigma around expressing mental health problem it's high, especially with men. In majority of cultures, maybe it's less in some cultures compared to the other one, but it exists in most of the cultures. And many men or even women in construction site, they might think that they will be seen as weak and fragile if they express or share with their colleagues that they are having a mental breakdown, or they want a day off or longer time off, and they will be perceived as somebody who is not productive, and they have a fear that they might lose their job, or if a future task comes up or a promotion possibility comes up, they are not seen as a reliable resource. But we have to learn and educate ourselves and others that it's very easy for us to get help when we have physical health problem, such as, for example, if somebody has injuries, they easily go to doctors, and mental health is not different than that. And it doesn't mean that there is something wrong. And there are other things such as health factors, injuries happen and people start using prescribed drugs for the injuries, and it might turn to addiction and drug usage, unfortunately, and that addiction will facilitate the process to suicide. So there are so many factors involved. I just touched some of them, but there are so many other ones. We have to make sure that we are aware of them. And as we talked about them, there are barriers for people to seek support or ask support. One of them is not having a paid leave day for many workforce. So as I said, they are working paycheck to paycheck, and most of people, they have a list of priorities when it comes to spending or investment or spending money on them, which is usually the children, parents, spouse, and many of us put ourselves at the end of the list. And towards the end of the list, if we want to prioritize, we prioritize investment on physical health compared to mental health, which that should change, and people should understand that. We talked about stigma, that should change, and it doesn't mean that the person who is looking for support is someone who is weak or fragile. And many times, sharing a story by a supervisor can be helpful, a personal story that shows that person also went through the same process, same challenges. And most of the time, unfortunately, when we see people who are successful or they are in higher level, they think that it was an easy, road for them. But the reality is the road was not that easy. And if we share them with others, it makes them to understand they are not isolated, they are not the only ones who are suffering, and they feel much better. And there shouldn't be any judgment around that if somebody expresses their mental health problem, challenges. So it should be understood by employer, by colleagues, and everybody involved. And there should not be a consequence or fear of retaliation, or somebody will be labeled as not productive or not capable, or losing a possibility of promotion. The other thing, having access to healthcare is very important. We need to make sure that people who work in construction sites, they have access to healthcare and they are covered by their insurances, because these are people who might not have a strong financial background and they might not afford if they are not supported. So these are some of the barriers. We have to look at them with different lenses, lens of, the employer, from the policy wise, from the government, what needs to be changed, and in terms of our colleagues. And we have to understand what are the signs of the suicide and mental health. And if we see somebody is going down that road, trying to help them. Now, here are some possible strategies that can be adopted by employers. It can be adopted by change of policies or government, and some of these strategies can be adopted by ourselves, and we can help our colleagues. So we need to develop policies in our companies to eliminate harassment and bullying as much as possible. This is something that happens sometimes in construction fields, and many women, they feel, or sometimes men, there's no difference. And they feel that they don't have a voice to express, and they feel isolated. We make sure that we are promoting equality, and gender, age, and race, they do not play factor when people work. Especially I've seen gender and age play a significant role in and how people feel isolated or causing stress for them. Training opportunities is very important. So make sure that the employer provides the training opportunity. And when we talk about training opportunity, it doesn't mean it should be days and days. So employers will be worried that they have to pay their workforce, but in return, there is no work. So sometimes even 1 hour training, it can be during a short time after hours. It can be very helpful. People understand the signs and the problems and how they can prevent that route. I'm sure nobody wants that happen for themselves or colleagues, because then the whole family would have a loss, and it's a huge problem. And also, we try to improve cooperation between supervisors and the staff, and make sure in the decision making everybody is involved in that process, and trying to have a better working relationship between people, and be a common understanding between both sides. Many of the problems in construction comes from, I talked about it, is schedule-driven projects, because some of the tasks are interrelated. It means that if we don't finish one task on time, there will be huge consequences afterward. So we make sure when we are designing the project tasks, they are not dependent as much as possible, or we have plan B, because that adds additional stress to people. We can also hire more personnel if it's possible. Again, many companies are on less number of resources, different type of resources, of course, financial, human resources. But if we can balance the workload, especially for people who work on longer shifts, that can be helpful, because long hours and long shifts, if it occurs, it's going to reduce productivity. And it's interesting that I had a research project before that people, if we ask people that, are you willing to work more, for example, during weekends and get paid more, for a certain number of weeks, they would say yes, and they're productive. But after that, the productivity goes down and the satisfaction goes high, which both of them will help with will lead to mental health challenges. So we have to be mindful of the workload that we are assigning to people. Providing counseling and access to mental health care providers is important. So counseling can be provided by the employers who have the capacity to provide, or access to external counseling services would be important. Opportunities to have growth at work and promotion, that's also very important. So people don't think that they get stuck in the repetitive tasks. There is a path for future. One of the things that I need to clarify is one of the sources of stress I've seen recently in workforce is related to automation. Many mid-age workforce in construction, they are very worried to lose their job in the next 5 years or 10 years, because they will be replaced by a machine or AI or other things. We need to educate people that construction, it takes a very long time for construction to be fully automated, if ever, and because of the uniqueness of the nature of construction. And we need to define a training path for people, and make sure that they don't lose their job if a machine can do their work, faster or at a less cost. We still need them. It might be a different task. We need to have trainings for them, but that anxiety is not helpful if it's always behind their mind. So providing instructions, clear instructions, making sure that people are on the same understanding of what is the objectives of the work that they have, and the working relationships, how we define a collegial working relationship is important. By having fair compensation, that's also important. So people should work and be paid fairly. Sometimes we've seen that people are asked to do more jobs at lower rate because of less supply of work. Construction work goes high and low depending on the market. Sometimes in housing areas, depending on market situation, maybe there is less availability of works, and then workforce might, because they have families, they might need to work at the less payments, and that would have a major impact on their mental health. Having recognition for those who work hard and promotion is important, and providing flexible working environment that might be more applicable to people who are working from in the office. But if there's something that can be honored and it doesn't impact productivity, it would be helpful. Maybe that's something that could help women more if they have children at home, and encouraging the open and transparent communication, which is similar to what I mentioned about sharing personal stories about the challenges that we had. And this is not just for construction. I think any industry, higher education right now. Before 20 years ago or more than that, I was working construction site as project manager. And I've seen that, communication and transparent communication and sharing personal stories, whether the difficulties that people face throughout that process, is very important for younger generations, so they don't think they are isolated. And also providing some assistance programs for employees that would be helpful, some support groups by the community and family members of construction workforce. And they need to have an understanding that this is a very demanding and difficult job. And sometimes some of these people might lose some important events. So it's important that we support construction workforce as a family member, as a community, and to help them and support them. And again, make sure that we help them not to go through the route of undesired outcome of the suicide, and help them as much as possible, recognize the signs, and support them to get help when they need it. I think we got to the end of that. So, Sean, if there is any question, I try to wrap it up within the time.
Yeah, I appreciate it.
I would be happy to answer if there's any question, or if you want me to elaborate on any of these topics. This is a very detailed, topic to discuss. I can talk about it for hours and hours. It's very important, and I hope there would be more focus from employers, government, and all of us on this topic.
Yeah, I really appreciate it, Dr. Sherri. I think really in your presentation, you hit on all three of those pillars that I talked about that we look at, are things that are in the workplace. So a couple of the points that you had in there that I thought were just critical that I'd like to reemphasize a little bit is strengthening economic support. So a lot of folks don't know that in the construction industry, by and large, whether you're union or not, you don't have access to paid leave, or you don't have, or if you do, it's not much of it. So if you're not working, you're not getting paid. So, and that creates, I know personally, that creates a lot of challenges and difficulty with life, with when you are sick or when you do need mental health support or physical support or doctor's appointments. So I do appreciate you highlighting that particular issue, because I think there's an assumption, and then the nature of the industry itself, it gets big and it gets small. It's very cyclical. So right now we know in the news, we need tradespeople and it's busy and there's a lot of work and there's overtime. Too much overtime is hard on people too. But it changes, and then you have long unemployment. And even when it's busy like this, a lot of trades folks are going through employment and unemployment, because jobs start and jobs end. So do you, you really touched on that as kind of one of the stressors that creates challenges for people. Like, what's your, what do you see out there in the industry? Is that sounds right? Is that kind of what you're hearing from people out there in the industry on one of the challenges that folks that work in the industry are facing?
This is one of the main challenges, and it affects their productivity, their planning ability. So sometimes I've seen people jump from one work to the other one, not necessarily look at that whole career path, but they want to feed their family. It's not right, because they have to work overtime. I've seen people work overtime up to 16, 18 hours per day when the market is in need, and sometimes they don't have any job to do. And this is, sometimes it's by season, depending on which state they are living. So this is not right, going up and down. It's going to affect their mental health, and this is one of the stressors on their family, financially, mental health. And we need to have some policies to manage that, to manage the market as much as possible, and have some constraints on the overtime that people are allowed to work. I understand they do it out of need, but we have to balance the work as much as possible.
Yeah, I think we're getting smarter about, I think we've known for a long time that excessive overtime hurts people. I think we're getting smarter about how much it hurts people when they're doing the excessive overtime. Plus, productivity falls off anyway, so it's not like you're actually gaining much. One thing I'd like your thoughts on is you mentioned access to healthcare. So I thought that mental health parity actually meant parity and that things were relatively equal. I've learned during our work from a construction contractor that that was not true, that, you know, like your health plan might have your $250 deductible or whatever it is, but the mental health side of the benefits they offered was something like $2,000 out of pocket before you got to any kind of. I know that final rule was issued recently to evaluate how parity works. What have you heard in the industry on how people are managing the concept of parity, or at least becoming more mindful to take a look at whether or not their benefits are actually paired?
One of the first things that I noticed that most of construction workforce, they don't have awareness of how much benefits they have on mental health. They are very familiar. They investigate on physical health. Mental health is something that people are not used to even go after that and get help. So they don't dig into it. And even if there's a small copay, they do not afford to provide support. We are talking about the workforce that are working in the field, not necessarily higher level at this point. So it's very important to educate them and make sure that we provide equal and fair access to the healthcare providers in terms of insurance access. And also some of the construction workforce, they're working in rural areas. So if they have proper access to telehealth facilities, if they don't have, the providers within the area. So these are all the things that should be looked into detail and make sure that the fair access is provided to everybody.
Yeah, I'll hammer, and you don't have to respond to this, but I'll hammer that paid leave one more time, because even if you had free mental health benefits, theoretically, a journey level worker in Michigan right now is probably earning somewhere around $40 an hour or more. And that's $320 on just a regular 8-hour day. So even if were free without paid leave, that's $300 that is gone. So they're building that into the equation too. I wanted to finish up on, and then we'll kick over to that video that we talked about from Man Therapy, substance abuse. You mentioned sort of increased substance abuse. And I can tell you that statistically, and I think you would say this, Dr. Sherri, the construction industry suffers from a higher degree of substance abuse than many other industries too. And what we're talking about there is alcohol. And I think the statistics on somebody that's in the grip of alcohol, that somebody that's struggling with substance abuse is multiples more likely to potentially die by suicide than somebody that's not. So it is one of those issues that we have to address. So do you have any thoughts on kind of how we tackle that issue in the industry?
Sure. One of the problems is the injuries that happen, that people ultimately, they get dependent on these substances. So we need to make sure that they get the fair and right treatment, and they don't have, after the prescribed drugs are stopped, they don't have to go to alcohol or other escape mechanism just to elevate the pain that they have. And also the stress, when it gets more than what it should, people, again, they look for escape method. So again, education is important, balancing the workload is important, and then make sure that if people are injured, they get the right treatment soon, so they don't have to go through the pain for long term, and then the doctors have to have a right care for them.
Yeah, well, I love it. I can't thank you enough, Dr. Sherri, for joining us today and sharing your experience in the industry and what we're trying to get out there, and how helpful this is to making sure that we get the message to those workers and start building a stronger society, frankly, but a stronger industry in construction by keeping people in the industry longer, making sure that people are taking care of all their industry. That's going to make them more productive. It's going to make jobs. It's going to make everything better. So we're going to help break down the stigma. As I mentioned early this month, we had our friends from Man Therapy on to talk about how impactful that has been for getting men more awareness of mental health issues and also reaching out for supports when they need them. So we'll close out today. Just thank you again, Dr. Sherri, and thank you all for joining us.
Sure. Thank you very much. And as the final note, I want to mention that we have to be careful what message we are sending to younger generations who want to join construction industry. Right now, their reputation is not good there. So we have to address these problems. We need construction workforce in future, and we have to make sure that all these problems are resolved. Thank you very much.
Hello, I'm Dr. Rich Mahogany. Welcome to Man Therapy.
The situation was dire. Suicide among working-age men was on the rise across the U.S., and there were no public service campaigns that specifically or effectively addressed men and their mental health needs. To make an impact on this complex issue, Cactus needed to invent a whole new approach, one that would reach men on their terms so that we could redesign their beliefs and behaviors about seeking help for their mental health. Our research found key belief and behavior challenges to be addressed. Most men believed talking about their feelings and their mental health was perceived as weak and unmanly. And when it comes to behavior, guys said that when they did have a mental health need, what they wanted most were tools they could use to try and fix it themselves, just like a car engine. And in order to reach men before it was too late, we needed to go upstream. We needed to get men talking about and working on their mental health needs before they were actually in crisis. We needed a sharp idea. We needed men to believe taking care of their mental health was manly, like hitting the gym for your brain. So we created Man Therapy. Therapy the way a man does it. More than merely an ad campaign, Man Therapy is a first-of-its-kind interactive digital therapy platform. At mantherapy.org, men meet fictional psychologist Dr. Rich Mahogany.
When a man faces a serious life problem like divorce, depression, or suicidal thoughts, shouldn't a man have a way to deal with that too? Well, now he does. I'm Dr. Rich Mahogany. Visit me at mantherapy.org.
To get guys to visit the site, we had to talk to guys like guys talk to guys, using humor to break the ice, shrink stigma, and get men thinking about, talking about, and addressing their mental health needs. It's psychology served with a side of bacon. And we deployed the campaign in places where we knew we'd be grabbing our audience's undivided attention. We also partnered with Facebook. Using predictive analytics, we were able to serve Man Therapy content to guys who showed signs of approaching a mental health crisis. And it's worked. So far, more than 1 million men have visited the site. 375,000 have taken the head inspection, and more than 36,000 men have clicked the crisis button to get immediate help. In addition, a 4-year, $1.2 million CDC-sponsored clinical study in the state of Michigan showed clear evidence that Man Therapy helps reduce suicide among working-age men. The campaign has been licensed in multiple states, as well as Australia. It's been written about in the New York Times, named Ad Age's Pro Bono Campaign of the Year, and presented at South by Southwest. By far, our most meaningful results are the emails, voicemails, and handwritten notes we've received from guys around the world, letting us know that Man Therapy literally saved their lives.
Hurry up, man. Pick a therapy.